So thank you for being with us today on this very hot topic about foundation models. I would first ask our panelists to introduce themselves quickly so that you will know all that they do. Nora, can you start?
Yes. So Nora Benhabiles, I am from the CEA, the Atomic Energy Agency. I am in charge of innovation, valorization, and startup creation for the Fundamental Research Division. I'm also in the board of the Healthcare Data Institute, so we have many work on white papers on these thematics for data for healthcare and AI and modeling. And I was also the past co-coordinator of the DigiTwins flagship, which was a project. It was not funded.
Thank you, Emmanuel.
So I'm the Chief Scientific Officer of the National Health Data Platform, which is the Health Data Hub. I'm a researcher in applied math at CNRS and at the AI Prairie Institute, and I'm a startupper and some many other things, but that's it.
Thank you, Emmanuel. It's your turn.
I'm David Cahané, General Manager and co-founder of Biop. Biop is a deep tech company created 1 year ago with one mission: to train the foundation model of biology to enable accelerated biological research.
Thank you. So probably we will start by a definition of about what is a foundation model. You're probably not all familiar with this. So what are foundation models? They are statistical models that could be classic statistical models like machine learning or using deep learning, so with neural network, that are designed to really understand the structure of the data they are observing. So it's usually requiring large data sets, of course, but the main question is how can we have data that are representative of the population we are looking at? How can we have a database that doesn't have bias and of high quality most of the time? So the principle of these foundation model is to be able to understand the structure of the data so that you can ask any types of question. They are not designed for a specific task. They are designed to understand the phenomenon you're observing so that you can ask many questions on that population. And the first example that came is for language. Large language models are foundation models that are designed to understand the structure of sentences, of text, of dialogues, etc., so that you are able to ask any of these LLM to summarize, to give you some information, to translate, etc., etc. They have not been designed for each task specifically, but to understand globally what's happening in the text. So, as a first example, LLM were very popular, but they are not always popular for everything. It's an example that finally was able to reach health data. And Emmanuel, can you explain us what is the example that the Health Data Hub is helping on LLMs?
Sure, with pleasure. So we are all here, I guess, convinced that there is a major impact of Gen AI and LLMs and so on health for research, but also for helping administrative tasks or saving time for the practitioner and so on. Now, we have one problem in Europe and in some other non-English speaking countries, which is that whenever you train an LLM using medical report sensitive data, because of its size, the LLM becomes sensitive by itself, and you cannot share it as easily. So what happens, like what we see in France, but in many other countries, is that everybody, like every health institution, is developing its own their own tools, and they are not sharing, not because they don't want to share, but because it's difficult to share. So this is totally insane. We are losing a lot of opportunities to mutualize the effort. So at the Hub, we are conducting a big project to try to launch a dynamic of mutualization with a lot of, most of the deliverables are open source. So our consortium is gathering 30 actors. So we have like 20 health institutions, 10 research groups specialized in NLP and health. And we have Mistral, Recital with us, so some startups. So what will be, we are starting right now, what will be the deliverables? We'll have a mid-size, why mid-size? Mid-size LLM specialized on French health text why mid-size? Because we want them to be able to be deployed in the health institutions. We'll produce some open source medical reports that will be fictive medical reports to be used for use cases. And we will develop 7 use cases with open source models. And in order to test them on real data, because that is important, we are going to deploy a federated evaluation platform on the 20 hospitals. So you'll be able to send your use case and have the evaluation on each of the real data of all these health institutions. So that's the project that is starting. We have 2 years. It's extremely short. And it's very exciting.
Sure. So text has been the first discipline where, well, application where foundation model came out. But actually, David, can you give us some examples of other types of data where foundation models are promising?
Yes, absolutely. So it's really exciting to think about foundation models that don't only understand text, but understand the language of biology, which is not text. It's sequence of genes, of proteins, it's tissue, it's image, it's radio, and all these data points that can be leveraged to train foundation model. And it's maybe less known than GPT, but in the scientific field, we have seen a lot of progress in the last years regarding these modalities. You have model working on protein sequences, for instance, like the AlphaFold or ESM kind of model that can predict the structure and also the function of the protein based on their sequence. You have models working on the transcriptomic data, and you have even models working on the histology slide. Histology is a biopsy that is very useful, especially in oncology, because it can help the oncologist diagnose the subtype of the disease, understand the potential outcome, understand which treatment the patient is likely to benefit from. And so companies like Biop have been training foundation model for histology, for instance. When we released a foundation model a few months ago for histology, it's open source. We are looking forward for the community to build on top of it and to enable better use case for the patient. And what are the use cases? It can be to predict mutation. It can be to predict outcome. It can be to have better diagnostic, to enable better treatment of the patient. So this is already a great milestone that we see on this foundation model working on biological data. What is even more exciting is looking forward to one foundation model that can work conjointly on several different biological data at the same time. Because histology or genes or protein is not enough to capture all the biological diversity and richness of one data of one patient. So we are looking forward to build this foundation model that can jointly encode histology, transcriptomics, genomics, proteomics to have a full representation of one patient.
Thank you. Nora, I'm turning next to you. These new technologies are very promising. They have to be validated on real data in a clinical trial or some clinical validation. What regulatory issues do we have to face?
Well, thank you for the questions. There are many regulatory issues. First with the GDPR, of course, regarding the data. And since health data are sovereign issues in member states, there are some issues of sharing the data, cross-member states sharing. And when it comes to foundation models, the AI Act, so that you know very well, that was launched on February 2, 2024, at the beginning did not take into account these foundation models, so they have to work again. I think it was, in 22, they just looked at what was going on with the different open AI and Google methods on this. And the Commission opened up again the negotiation on that to try to find out first a definition of the foundation models and to try to find consensus among member states, which was quite complicated. So they came up, to make a long story short, on the general purpose AI models with 2 definitions, generic one and systemic one. And for these 2 definitions, so the one what is generic, as its name is generic, and systemic is more defined on a specific purpose, especially, for instance, in healthcare, and to have different type of regulatory aspects. So a first one for the generic GPAI, that is consisting, for instance, very briefly, of transparency and there is some obligation to share the technical documentation, which is an issue, not to have black boxes, and to try to understand what is behind the methods, and specifically what the algorithm are, and whether there are also viruses or so, because they might also have some issues. So you have to understand exactly what is in behind the methods, the data training process, and also, of course, the data source, the data quality, as you mentioned, Stéphanie, of course, there is key, and of course also the third-party involvement. So this is the first level, I would say, of regulatory aspect regarding GPAI for the systemic model, and there is a kind of EU AI officer that takes care of that, and that may take also all the documentation related to that. So we might have a lighter regulation in case of open source, like you mentioned before, so that generic GPAI is free and open license. So in this case, it might be a little bit easier. And then when it comes to the systemic GPAI models, here a lot of discussions came around, and what was decided at the moment is that the first level of, I would say, obligation, the one on generic model apply, plus, in addition, different issues regarding how the evaluation of the model was carried out, which is always extremely important in terms of sensitivity, specificity, what is behind afterwards the prediction. Is it really predictive or not? And especially when you have some data where you have a lot of outliers, you might have issues to predict some aspect of, regarding these outliers. For instance, in rare disease, we just discussed it before, or some patients that are a bit different, that were not, the data were not trained with these data patients. So this is the first part. And adversarial tests to identify and mitigate risks. So the risk aspect is very, very important too. And so, as for the RGPD, you should report incident. So this is the way it's done. Of course, each member state, we have the freedom to elaborate a little bit differently based on this first, I would say, cloud of regulation. And that would also help people to develop better methods. So maybe the way to define how it should be done, it's best practices and obligation and risk analysis.
Thank you. So we know that things are developed currently, and we can actually, fortunately, highlight several success stories already. Emmanuel, can you probably give us one success story regarding research that has been
Yeah, I was
reached?
thinking about which one to pitch. We have many. I could talk about European projects where we are heading big projects on how national platforms, what is the role of national platforms in the life cycle of medical device involving AI. So this is a 30 actors consortium again. But I would like to pitch something else. Okay, I told you about, very quickly, I told you about this LLM project that we call Partage. The goal is to start a dynamic in France and that it is replicated elsewhere. So I don't know if you know, but there is this summit in France on AI. And there is, within this framework, there is a call for project to have an opportunity of pitching an international project. So basically, I contacted many people with this Partage project and saying, are you interested in it? Do you want to be part of it in the next step at an international level? And one success story, it's just a communication thing, okay? But one success story, I think it's a success story. It's within 10 days, I succeeded in raising 60 institutions worldwide, 12 national platforms in Europe, 20 research teams in Europe in 15 countries, startups, research teams in India, Japan, Burkina Faso, Senegal, Quebec, and so on. And everybody is like eager to mutualize the effort on building non-English speaking LLM on health, and they are facing the same regulatory issues as we are facing, and they really want all of them to work together.
Great.
So it's the beginning.
Yeah, but it's a good beginning, good start. David, can you give us probably a success story not coming from Timus still, but from Okin?
With pleasure. And but first, as a researcher, we see success story every day. It's incredible the speed in terms of new breakthrough, better performances, better architecture, and so on. But what is really exciting in what it impacts downstream patient and the patient lives. And it's not science fiction anymore. Foundation model in histology are already impacting patient life. If you take one disease, for instance, colorectal cancer, it's the second most deadliest cancer in the world. And some patient will benefit from treatment, but might not know it. And how to bridge this gap? This is where AI and foundation model can help. Because if you use the molecular test, it will it costs $100 or $1,000. You have to wait weeks in order to get the result, to know if you're eligible to a certain class of treatment. If you use AI model, it's 15 seconds and only cents to get the result. And this is not science fiction. We have diagnostic tool, for instance, the Okin diagnostic MSI treat tool that works today on CRC to help predict this molecular status, to help eligible patients benefit from it. So it's an exciting time.
Thank you. Nora, it's not only a question of France, and Emmanuel showed that everybody is keen on joining the efforts. Do you have a success story to talk about also?
Yes, thank you. There is first maybe a small side effect. A lot of projects at the European level, so in AHI, IMI, Initiative Medicine, Innovative Initiative Medicine, in also, of course, in France with ANR and so on. And so there is a lot of competing projects. It's a will at the European level to see what will emerge in terms of standards, in terms of regulatory aspect management, and also in terms of data sharing to specific endpoint. So knowing the complex landscape. And Charité has done a lot of things on that, but as many others in Europe. But I have also looked at the Helmholtz Association Foundation. So they have done a very interesting work at the moment. So they have invested 28 million euro in different projects on various aspects of AI and generative AI. So with the Helmholtz AI Compute Resource, the Karlsruhe Institute of Technology, Jülich, and the Max Delbrück Center. And they're preparing 7 projects at the moment with different use cases in clinics and to try to look at different aspects of that. So I think it's very interesting what's going on, especially in Germany. Of course, in China, there is a lot of things and there is a lot of review. China is emerging with a lot of money there, so they might compete also strongly on these aspects. The States, of course, and there is also an initiative in the States, in Stanford, that is quite interesting, the CheckEye initiative on foundations model. So a lot of things going on, a lot of competing models, and what will be interesting is to evaluate the value of these models, to integrate it for Europe.
Okay, we're just on time. Thank you very much to our 3 panelists, and thank you to the audience.